Well, welcome to the Wisconsin Coalition Against Sexual Assault's review of Wisconsin's 2015-2016 legislative session. I'm Dominic Holt, the Policy and Communications Coordinator with WCASA, and with me...
Good morning, everyone. This is Ian Henderson. I'm the Director of Legal and System Services with WCASA.
So please feel free to ask questions during the webinar using the chat window in your GoToWebinar viewer window. And if we end up taking too much time for questions as we go through, we may ask that folks hold off on questions until the end. But otherwise, please go ahead and ask those questions as they come up. All right, let's get started. This two-year legislative session, as they are in Wisconsin, is proof that your voice really does matter, and lawmakers really do listen to you when you speak up. Some good examples of that are throughout the webinar. You all helped pass a number of key bills. You helped us advance other bills, and you helped us stop a particularly discriminatory bill, which we'll also talk about. So the images you see now are from our 5th annual Wrap Around the Capitol, which was fantastic. We had, I think, approximately 200 folks come, which is by far the biggest group. All 200 are not in this picture. This central picture shows folks lining up around the circle inside the Capitol's rotunda, holding up the jeans that have been decorated by survivors and chanting as part of the Wrap Around the Capitol event. We also had a number of speakers. You can see on the right-hand side, Callan Hardy speaking. He's a noted author, playwright, survivor, and advocate. On the left, you also see Deja and Haley, who are youth activists from the Dane County Rape Crisis Center's Youth Advisory Board called Game Changers, and they were excellent as well. So, just a little save the date to begin the webinar. This coming March, though we don't have the exact day yet, save the entire month, make sure it's all WCASA all the time, for our 2017 Legislative Advocacy Day. So this is a collaboration between WCASA and End Domestic Abuse Wisconsin, our sister organization that works on domestic violence matters in Wisconsin. We often have policymakers as speakers, followed by briefs from often myself and my colleague at End Abuse, Tony Gibbart, on what the key requests are for your following meetings with legislators and their staff. We also discuss best practices for communicating with them. It's a really excellent day. People that come are always so I'd say really energized and give us wonderful feedback. We usually have a room reserved in the Capitol where we provide all-day support to folks when they come before or after meetings about, hey, how do I do this? What does this policy mean? What does this ask? Or I also want to talk about this issue happening in my locality. How do I do that? And we can do a debrief afterwards and such. So we do this every 2 years. We do it basically right around budget time during the 2-year biennium, legislative biennium here in Wisconsin. So please keep that on your calendar. And we'll let you know when we actually have a day. So this is what the webinar is going to look like. We're going to go through the landscape. We're going to talk a little bit about the agenda we used during this session. We're going to then launch into the meat of the webinar, which are basically the bills that we worked on, supported or opposed, etc. And we have them broken out in 4 categories, which I'll describe in a couple slides. And then we'll be wrapping up with what you can do to help be part of the change process and the policy-making process, etc. Okay, first the landscape. So during the 2015-2016 legislative session, we had a very complex, complicated, interesting landscape. The 2014 elections favored Republicans, and we are nonpartisan here, but that's how the elections This strengthened their majority in the legislature, and so they continue to control both the Senate and the Assembly. And of course, Governor Walker was still Governor Walker, and he was also running for the presidency at that time, which really emboldened an already conservative governor and conservative legislature to push their agenda priorities, their policy priorities. That resulted in, unfortunately, a lot of budget cuts, especially severe ones to the University of Wisconsin system, $250 million budget cut, shifting funding from public services often, such as public schools, to private schools via vouchers, and many other policies that unfortunately disproportionately affect historically oppressed groups based on income, race, immigration status, gender expression, etc. But it wasn't all challenging. Something interesting really occurred and continues to occur in that these politics, these priorities, as they were confronted by the wider public awareness and discussion of sexual violence, we've had some interesting opportunities. This wider awareness and discussion in the public of sexual assault is largely due to, well, a variety of factors, but certainly the White House's work on campus sexual assault, such as their It's On Us campaign, their Not Alone report, the media reporting of campus sexual assault, celebrity cases, human trafficking. That's really become very, very pronounced in recent years, which has helped drive the narrative. There's been many prominent films, music videos on these issues. Social media has also really been blowing up with conversations about sexual violence. So many lawmakers on both sides of the aisle have been wanting to do the right thing about sexual violence for a long time, I think. And I think perhaps this increased public awareness and discussion of sexual violence may really help them feel like, okay, I have more public support to really address some of these things, which is fantastic. And this was an incredibly helpful thread throughout our advocacy this session. We had many Republicans really step up with their colleagues, the Democrats, to do some very interesting and helpful bills, which we'll talk about. So, before the beginning of the legislative session, WCASA developed this public policy agenda, which you see, the first page of which you see here. This was informed by the membership-based Public Policy Advisory Committee. We used a transparent agenda setting process, which is described in the agenda document itself, and you'll see a link there to the document. And this agenda setting process enabled us to prioritize issues and policy positions along at least three, maybe four tiers, actually. We won't go through all of that here. We certainly can answer questions about it. One of the interesting things, though, I do want to mention is that there are specific criteria that WCASA and the Public Policy Advisory Committee used in making these decisions. I'll just mention all of them, I guess. Those criteria were, things like what was the impact, or what would the impact be on survivors of sexual violence if we worked on said issue or said bill. Is it aligned, or how is it aligned with WCASA's long-term interests? We'd be looking for substantial agreement among members on this issue as represented by the Public Policy Advisory Committee. We'd also be looking for where were the gaps or lack of adequate coverage by allied organizations on a particular issue or bill or whatnot. And also the ability to achieve a meaningful policy outcome given this rather complicated and complex landscape we mentioned. And lastly, timeliness. When do we think things will be occurring? It's an interesting mix of different criteria. So this agenda served as a living blueprint for our advocacy work during this session. All right, here we come. The bills in review. We will review the legislation in four categories, as I mentioned. A, we'll be looking at what we're referring to here as highlighted bills. This basically means the bills that were of the highest working priority based on our agenda. B, intersectional means bills that particularly affect historically oppressed groups and other issues that intersect with sexual violence. And then the last two are pretty self-explanatory. We encourage people to download the legislative recap document that you see at the bottom of the slide. It is titled, and I hope this doesn't create confusion, Highlighted Bills of the 2015-2016 legislative session. And even though it uses the word highlighted, it really means all the bills that we're going to discuss across these 4 categories, and it also includes a couple of others. So a couple of housekeeping notes. As we discuss the bills or legislation in this webinar, the word act or acts really means a bill that the legislature passed and the governor signed into law. So when you see Act 350 or whatnot, that means the bill was successful and passed. Other places we will note bills that failed, for want of a better word. Those are bills that didn't pass the legislature. And if lawmakers want to consider them next session, they'll have to be reintroduced. All right. Any questions? Doesn't look like it. All right, so highlighted bills. This is the list that we're going to talk about. Kind of give you a minute to digest. It's, the first one is one we work on a great deal, sexual assault victim services funding. Then victim accompaniment you've heard of, data reporting, child sex trafficking, statute of limitations, you'll get more information about that, and sexual assault victim amnesty. All right, so increased and consistent funding for sexual assault victim services, prevention, and education really is the most effective way to end sexual violence in our state and to help survivors. The SAVES grant program, or Sexual Assault Victim Services grant program, is key to this. It's the only state program that provides funds for this type of work. Examples include the 24/7 crisis hotline, support groups, personal support, guidance in the medical and criminal justice processes, community education and outreach, and prevention work. Increasing SAVES funding is also critical for service providers who want to expand access to their services and prevention for historically oppressed folks. This might include hiring more bilingual advocates, providing more culturally specific programming, more targeted outreach. So during this session, the governor proposed basically no change to the funding of the program, which was at $2 million annually. As many of you have heard us talk about this in the past, that's a very inadequate amount. It's split among 44 organizations across the state, and this funding does not even touch 5 counties. You see them listed there. So people across the state spoke up. We collaborated with activists throughout the state, throughout the process, at budget hearings in Madison and throughout the state, at town halls, and in specific meetings with our lawmakers. Folks also responded to our action alerts by writing, calling, emailing, and meeting with their lawmakers to tell their stories, to tell them the importance of funding for this work, and asking lawmakers to support survivors, services, and prevention. You know, your collaboration with us helped us achieve 2 important results. First, we were able to garner legislative champions on this issue, paving the way for future advocacy on the budget and other legislation. Key lawmakers on the Joint Finance Committee made really moving statements about the need for increased services and prevention during one of the hearings. Second, we were able to actually increase funding for SAVES by $100,000 in year 2 of the budget, of the current budget. Though it's not a lot of money, it represents huge progress given the current climate of slashing funding and programs, as alluded to earlier. It also resulted in the most funding SAVES has ever had. Now, budget season is beginning again very soon. for the next budget. So stay tuned for email updates and action alerts from us to work on increasing funding again. So next is Ian.
So one of the other bills that you've undoubtedly heard WCASA talking about in the last few years was the victim accompaniment law, which we are pleased to say passed this session finally. And I do want to call your attention to a couple of resources at the bottom of the screen. The webinar, which is a comprehensive overview of the final bill and the law, as well as a written summary available by link there. So I'm not going to spend a lot of time talking about the ins and outs of accompaniment because we have that that information elsewhere. And I've been trying to get out to regional meetings and covering that topic as well. So, but know that you have that information at the bottom there to really go through the law. And what I will say is, you know, I wish the law were completely straightforward to discuss, but one of the things I'll highlight is, as you can see up there, right, with some exceptions, it affords sexual assault, human trafficking, and child sexual abuse survivors the right to be accompanied, if they choose, by a sexual assault advocate throughout both the criminal justice process, and we're thinking law enforcement interviews and other proceedings such as prosecutor interviews, post-conviction proceedings, as well as the medical forensic exam. And so really, the way the law breaks down is looking at the medical forensic exam, medical proceedings, and criminal justice. That's what makes the bill a little cumbersome to talk about because the provisions in both sections, the criminal justice and medical, they operate a little bit differently. So again, you have the information about that, more detailed information, the resources there. And one thing I want to call your attention to, obviously, we think this is a huge success, and we're really pleased to see this bill become law. And in about, 5 days, I will say it will be law. So the law takes effect August 1st of 2016, so that's just around the corner. And in lieu of that, pending effective date, DOJ, Department of Justice, Department of Health Services, and the Hospitals Association and WCASA have been meeting regarding some statutorily required guidelines and forms that the statute requires both DOJ and DHS to develop guidelines for the hospitals, as well as to develop a model form regarding notification. Again, there's more information about victim notification in those resources. So those will be coming soon. Dominic and I were just on the phone this morning with those entities trying to make final tweaks and edits to the guidelines. And obviously once those are ready, we will disseminate that information for you as well, because the guidelines we're hoping to see really be taking the law and also aiming for what we think of as the spirit of the law and the intention of the law to really give sexual assault, trafficking, and child sexual abuse victims notice of what their rights are under the law. So stay tuned for more information on that.
Excellent. Data reporting. During the legislative session, our agenda included seeking an annual comprehensive resource on sexual violence-related data, so that we can begin to see where resources are needed most, what kind of trends are occurring, and other insights that only data can reveal. The last best effort on this was WCASA's own 2010 report. It's called The Burden of Sexual Violence in Wisconsin, or we sometimes just call it the Burden Report. This was a one-time report made possible through a CDC grant. We are currently working with the Wisconsin Department of Justice on an updated online resource approach for providing sexual violence-related data. This would likely be on DOJ's website and something that ideally they would continue to update and improve over time. Details will be forthcoming. All right, now child sex trafficking among the highlighted bills here. This was, well, this covers 3 bills, or first a piece in the state budget and then 2 actual pieces of legislation. The Services for Child Sex Trafficking Victims was $2 million directed to Wisconsin's Department of Children and Families. Under the budget, we supported it. It passed. This is primarily to help DCF in developing services for child sex trafficking victims, and they've been focusing primarily on a residential facility approach, plus whatever they have left over, going to creating a regional hub model of community-based services. So that is still very much in process. We don't have a lot of details yet, but it'll be interesting to see how the department proceeds with that. Next is addressing child sex trafficking. That's not really the title of the bill, but that's really the best way to summarize it. That is Act 367. For more information, you can click on that link, or you can go to the summary document we mentioned on I think maybe the overview slide that talks about all of the bills. And then Safe Harbor for Sex Trafficked Youth, that's a particularly important bill we worked on. It did not pass. We did support it, and we do have more to say about that. So this bill only had one hearing in the Assembly. We did testify in support of the bill. It would change how the criminal justice system treats sex trafficked youth. Instead of as a delinquent or criminal, it would treat them as a victim or survivor, which is pretty important. It'd be shifting the whole paradigm of how criminal justice approaches these survivors. It would also prevent prosecution of minors for prostitution, which is a big deal. In addition, it would require the law enforcement to refer potential cases to a local child welfare agency, and then those agencies would be required to investigate to determine if the youth needs protection or services. Now, this part was included in the previously mentioned Act 367 addressing child sex trafficking. The prosecution for prostitution was not included in Act 367. Something to mention, by broadening within the bill language to non-caregivers, the bill specifically targets traffickers and pimps. That's also included in Act 367. I should mention that we're still looking at what we will be pursuing in terms of sex trafficking next legislative session. It may include working toward a version of Safe Harbor that includes eliminating prosecution of minors for prostitution, but it may not. I'm not really sure. We're still developing that.
Another bill that we want to talk about is Act 21, another law change regarding the statute of limitations. Many of you are aware that this is an area of the law that has evolved in recent years and has seen significant changes. Act 21 continues that evolution in the way our statute of limitation law has changed over the course of time, and you might remember a few years ago the legislature for the first time removed the statute of limitations for first-degree sexual assault. The first time the legislature changed, in this case eliminated completely the statute of limitations for a sexual assault crime pertaining to adult victims. The legislature this session continued on that trend by increasing the statute of limitations for second and third degree sexual assault. So this is sexual assault under Chapter 940, right, the crimes that usually pertain for adult victims, lengthens that from 6 to 10 years. And that took effect on December 18th, so 6-7 months ago. And right applies to an act for which the statute of limitations had not yet expired as of that date, essentially meaning if the time frame had not expired as of 12, 18, and 15, for the second and third degree, the new time frame would apply. And so this is just keeping Wisconsin, we think, in line with the way this law has evolved over the years, and that many states have statute of limitations for comparable crimes set at 10 years. So Wisconsin is kind of keeping in line with how this area of the law has evolved, not only nationally, and then just noting that last year Congress repealed the military's 5-year statute of limitations for sexual assault and sexual assault of a child. So further evolution on this in this area, and I think something we're really pleased that the legislature has been receptive to providing more time for the criminal justice system to hold offenders accountable.
So, sexual assault victim amnesty bill. This passed as Act 279. It prohibits law enforcement citations or UW system discipline for alcohol violations of underage folks who experience sexual assault or human trafficking. It also provides amnesty to bystanders who seek help for the survivor. Wisconsin DOJ has assured us that law enforcement training and outreach on Act 279 will include a focus on best practices to avoid strong-arming minors into reporting. This bill was really focused on the situation in which there are typically college parties, but could be, other parties where underage folks are drinking alcohol and something happens or something is about to happen. So that's what the focus was. And I should mention that the prohibition on a ticket from law enforcement applies to any underage person who is in this circumstance, not necessarily just folks in the UW system. Folks, however, who are in the UW system, they then are afforded or can be afforded the prohibition on discipline for this kind of problem. All right, intersectional bills. Here is a list of what we're going to talk about quickly. I'll just move on to the next slide. So, yes, we had a victory. This was another good victory, actually, in that the bill did not advance out of committee. Assembly Bill 469 would have prevented schools from allowing students to use restrooms that accurately reflect their gender identity. WCASA worked with End Domestic Abuse in issuing a joint statement opposing this bill and offering testimony at the hearing. We each submitted testimony on at the hearing. It was amazing how this played out, in that people showing up to give testimony or just to stand in the room and show their opposition via their presence was hugely impactful. There must have been 300 folks who came to this hearing, which is astounding. And, oh gosh, I would say a huge proportion of that group were made up of, they look to be very young people, perhaps middle and high schoolers who were there, and many of whom actually gave very impressive testimony, really awesome testimony, sometimes even kind of educating lawmakers, if you will, about issues confronting people who are transgender or otherwise gender nonconforming. WCASA continues to be active on the policy committee that spearheaded this work. That policy committee is part of the Wisconsin Transgender Health Coalition, so WCASA is proud to be part of that coalition and that committee. Unfortunately, the author of the bill promises to reintroduce the bill next session, next session, and to model the bill after a particularly discriminatory bill, House Bill number 2, that was passed in North Carolina. That and other states' legislation prohibit LGBTQ protections. So that's a real problem, and we'll be working on that for sure in the future. I should mention Wisconsin, unfortunately, is one of 13 states suing the Obama administration for its directive to U.S. public schools to let transgender students use the bathrooms and locker rooms that match their gender identity. It's just something worth noting. Reproductive health as another intersectional issue. WCASA strives to protect or advance people's access to reproductive health care. We've been very open about that. Restrictions to reproductive health care, like abortion bans and defunding family planning clinics, they ultimately limit the control survivors have to make decisions after an assault. Limiting access to abortion can also re-victimize survivors and impede their long-term recovery. So these kinds of bills are very problematic. We opposed the abortion ban and both of the bills that were blatantly just trying to defund family planning clinics and STI clinics. For many reasons, they pursued this, including that Planned Parenthood happens to run some of these clinics. These kinds of bills disproportionately affect communities of color, though, who often must rely on low or no-cost clinics for their entire health care. So that's another reason why we strongly oppose these. And all three bills were passed into law, as you can see. Food share. These bills are apparently intended to try to decrease the numbers of low-income people using public programs. So these bills particularly affect communities of color who are also disproportionately impacted by sexual violence. The first one, the photo ID for food share recipients, Assembly Bill 222, failed. We opposed it. Among other things, this bill would add a photo ID to the electronic benefit transfer card used for food share, or food stamps, as it's also known. AB 222 would also seek permission to require food share recipients to use this ID benefit card when making a purchase with the card. The second bill was not really a bill or legislation. It was a provision within the state budget. This last time around, we opposed it. It did, however, survive and stayed in the budget. It requires the Wisconsin Department of Health Services to conduct drug screening and tests of individuals applying for food share employment and training services. Immigration. Several places in Wisconsin, such as Madison and Milwaukee, are considered by some to be immigrant sanctuaries because these localities have created policies and passed laws trying to protect immigrants from deportation. This includes preventing government employees like police and others from asking about and reporting on the immigration status of someone they've already detained or arrested. Senate Bill 369, Assembly Bill 450 would have superseded these local laws in an effort to make localities abide by federal immigration policies and laws that are intended to increase deportation.
There was also some negative progress in regards to the area of housing and housing law. Really, Act 176, which is something WCASA opposed, along with end abuse, weakened protections that had been a product of bipartisan legislation in previous sessions, offering protections for victims of sexual assault and domestic abuse. And this act really, among other things, allows the landlords an expedited manner to terminate a tenancy without providing the tenant to remedy the situation if a member of the tenant's household or one of their guests engages in criminal activity. So this was really, from our perspective, a backward step and an erosion of important victim protections in the area of housing law, and something we opposed. However, it did, in fact, become law.
Other criminal justice bills. So we'll be talking about internet crimes against children, victim compensation, restitution, and notification, pay progression for prosecutors, assistant district attorneys, supervised release, and privacy. So, internet crimes against children, which here we abbreviate as ICAC, that passed. It's Act 369. We supported it. It provides funding for criminal investigative operations, prosecution, and related activities concerning these crimes. It also authorizes the Attorney General to issue what's called administrative subpoenas, basically to issue something that requires internet service providers to give the law enforcement folks certain information to aid an investigation. That's kind of wordy, complicated. Basically, it's intended to enable quicker and more successful investigations of internet crimes against children. That took effect April 21st of 2016. Victim Compensation Program. So this passed, we supported it. It is now Act 350. This took effect on April 13th. It allows DOJ to, among many things, waive the requirement that survivors report a crime to law enforcement within 5 days of that crime, or within 5 days of when it could have reasonably been reported. Some other changes to the program include expanding the type of compensable medical treatment, that is, medical treatment you could get compensation for, to include psychiatric and psychological treatment. It also adds invasion of privacy to the list of eligible crimes for this program. It allows a child survivor's parent up to $3,000 reimbursement for mental health treatment and work losses. Unfortunately, it does narrow the type of reimbursable medications to prescriptions, limits comp to eligible expenses incurred within 4 years of the injury. And then, if a survivor was a child when injured, DOJ can cover eligible expenses for 4 years, or a maximum of $40,000. And this can include expenses incurred up to 1 year before the application was filed. Also, it awards no more than 2 weeks of lost wages without requiring physician's proof of disability. Previously, a physician's certificate of disability was required for the department to pay any lost wages. Now, that's a lot to digest. Please feel free to take a moment and let us know if you have any questions, and then we'll move on. Thank you. Also, don't forget the document we gave you a link to back, I think, in the overview slide or early in the webinar. It provides the entire summary we developed. Hopefully it is clear and concise of all of these bills and issues, as well as a few more. So if you missed something during the webinar, it's okay. We're also giving you the slides or handouts of the webinar, I believe. So you'll have multiple ways to review this information, and you always feel free to contact us with questions. Oops, I missed one. All right, restitution. We supported this. Act 355 makes survivors the first entity to receive restitution payment in what is a long list of agencies and such that do get restitution payment from the criminal. This way, the survivors are paid before government agencies. It was the other way around before Act 355. It also provides some new tools to ensure more restitution is paid. Notification, we supported this, Act 354. It creates a right for a crime victim to receive notice when the offender is released to parole or the offender's extended supervision is revoked for violating some condition of release. This took effect on April 13th, and it first applies to any revocations that occurred on April 13th.
Okay, next I want to talk a little bit about pay progression. That's something WCASA has been supportive of efforts to ensure that pay progression for assistant district attorneys has been funded. We recognize that many of our partners in the DA's offices across the state are having challenges in retaining experience that can have an impact, excuse me, an impact for sexual assault survivors. Prosecuting sexual assault crimes are complex cases. Often it would be helpful to have experienced prosecutors on staff to, if not take those cases, at least be a resource for prosecutors. And that's something that DA's offices across the state have been experiencing challenges with. And so we've been supportive of efforts to increase funding to hopefully increase retention of experienced prosecutors across the state. In the budget that was proposed by the governor early in 2015, he proposed completely eliminating the funding for the pay progression. It's a little complicated to talk about, so it's increases, and I had to wrap my non-math brain around it in preparation for talking about this, so I'm going to try and simplify it. So the governor proposed eliminating that funding for the pay progression. And obviously there was some opposition to that. The legislature did end up restoring a sort of modest amount to fund basically what would be a 2% average salary adjustment. However, it still represents, as you can see, a significant cut to the progression that was enacted in previous budgets. As you're probably aware, we often see action by the legislature on issues regarding sex offenders. It's a sort of perennial area of lawmaking. Do we have a question? The question is the $6.84 million allocated by county? That is a really good question. I am just looking at the document. Dominic, if you happen to know the answer soon.
I happen not to know the answer,
okay.
But we can certainly look that up.
Yeah, we would be happy to check into that. I don't know off the top of my head how it's merit-based pay progression. I don't exactly know how that amount is spread throughout DA's offices.
That's a good question.
It is a very good question, yep. Okay, so residency restrictions. Yeah, as I mentioned, an area where the legislature often makes changes to regarding supervised release. So as I'm sure many of you know, we have Chapter 980 in Wisconsin law that allows for the civil commitment of sexually violent persons who are committed civilly after their criminal sentence runs out. What this law does is basically impose restrictions and requirements on where DHS, and DHS is the department that runs the Chapter 980 civil commitments, or where those sex offenders are housed, on where they may place an offender who's released on supervised release. A lot of releases happening in that sentence, but I think you understand, right? So it's tweaking where offenders, when released on the supervised release, can live, and also imposes some distance restrictions. Again, for more information on that, you can see our the document we created on our legislative summary.
And I should mention, Peter has put that document, as well as our public policy agenda, as well as the actual slides or handouts of the webinar, all in the handouts box of your GoToWebinar situation. Control panel, thank you, Peter, on your computer. So you can download those right now, which I really recommend you do, because those are excellent, excellent resources. Privacy. So generally, no, I'm not. I'm sorry. This is
privacy. So some significant areas of evolution regarding the invasion of privacy bills, or invasion of privacy and laws that Wisconsin currently has. So there was several bills. You can see 4 up there. And really, sort of a quick overview is this is an effort to not only, in some cases, increase penalties for these crimes, but to bring Wisconsin law up to modern technology. So I'll touch just very briefly on those. You can see Act 80, kind of the upskirt bill was the way this was talked about in the in the media, really referencing using any sort of device to view or record someone's intimate parts underneath the clothing. Invasion of privacy, that Act 292, it really looked at changing the way Wisconsin law defined a surveillance device. It kind of had this very specific definition that may not include things such as cell phones. We all know that many smartphones have cameras and recording devices on them. Act 292 is that effort to bring Wisconsin law up to modern times. Act 320, privacy invasions against minors, that increased the penalties for those crimes when an individual who is observed is under the age of 18. And finally, Act 370 prohibits, again, closing a loophole in Wisconsin law that prohibits a parent from capturing an image or possessing or making a representation of a child for the purpose of sexual arousal, gratification, humiliation, degradation, or monetary gain. Again, there was as often happens, cases come up and they may allude to or highlight weaknesses in the law, and really Act 370 was a way to close a potential loophole in Wisconsin law to ensure that there's an effort to hold those perpetrators accountable when they are capturing images of a parent is capturing those images of their child for, again, sexual gratification, humiliation, etc.
Excellent. Address confidentiality, Act 365. This is something we supported. It was spearheaded by Legal Action Wisconsin, and certainly we supported it. It creates a substitute address program survivors of domestic abuse, sexual assault, or stalking can enroll in. And this would be to enhance their privacy from essentially their abusers. More information, again, in the resources we have indicated. I believe it will be housed at Wisconsin DOJ. Okay, the next category, other child youth bills. We're going to talk about the Child Victims Act, Child Sexual Abuse Education, which is also known as Aaron's Law, which many of you may know or have heard of in other states, as well as abuse and neglect investigations that involve children who have disabilities, healthcare provider mandatory reporting exception, which we will try to elucidate for you. That's kind of an interesting sentence. All right.
Child Victims Act. Again, something you have probably heard about from us in past sessions. This is an area that WCASA is supportive of efforts to see this law pass, which it has not as of yet. We were close a few years ago, but there's a lot of survivor advocacy on this particular bill, and I think other states have paved the way and have enacted similar types of legislation. So I think it's something we're likely to see pop up again. Basically what it does is looks at the civil statute of limitations and eliminates the civil statute of limitations for an injury resulting from sexual assault or incest as a child or sexual contact by a member of the clergy. Currently the law is the civil statute of limitations for those civil actions based on that type of criminal conduct is until the survivor reaches the age of 35. So one thing this would do was eliminate the statute of limitations for those causes of action. And secondly, it also would provide a 3-year window, which would basically, for a survivor who currently is barred from filing a civil cause of action based on what would be criminal child sexual abuse, they would get a 3-year window to file a civil action against their perpetrator. And so those are two really important pieces of the legislation. But again, that did not pass. WCASA has supported those efforts.
Okay, and then child sexual abuse education, Aaron's Law. This is Senate Bill 501, Assembly Bill 691. This did not pass. WCASA did not take a position on it. We were not part of the drafting of this bill, despite our attempts to engage. We didn't take a position because the bill was introduced so close to the end of the session that it was clear the bill was very unlikely to pass this session. And as much as we greatly appreciate the light that this popular state law, Aaron's Law, has brought to the issue of child sexual abuse, the model legislation unfortunately touches upon a few important areas, but really is not sufficient for preventing child sexual abuse. And that is frequently kind of the frame that folks use when talking about this law, Aaron's Law, to prevent child sexual abuse. But to prevent that effectively, legislation must really take a much more comprehensive approach that considers impacts, interventions, and prevention strategies for children, people that care for children, and the systems and institutions that impact children. So again, unfortunately, the model legislation just focuses on a narrow selection of often less successful approaches to prevention, like essentially relying too heavily on children to prevent their own abuse. That's why WCASA developed the 10 core concepts to preventing child sexual abuse document. Everyone should definitely read that and become familiar with it. It is highlighted actually by the recent policy statement that the National Alliance to End Sexual Violence put out regarding Aaron's Law and child sexual abuse prevention. For more details, please take a look at these links. The statement is right there for your linkage. Oh, and there's a typo. I use speech recognition software. So Aaron should be spelled E-R-I-N, but my computer thinks it's A-A-R-O-N. So apologies for that. Okay, and then this bill was spearheaded by Disability Rights Wisconsin, Act 365. We supported it. It requires the Department of Children and Families to create and implement a plan for improving their practices that they use to investigate reports of suspected or threatened abuse or neglect of a child with a disability. You know, I think the primary situation from which the bill arose are situations in which children may have disabilities impacting their ability to communicate with child welfare staff and other disabilities. It would require this Act 365 does require the department to develop the plan with input from the stakeholders you see there. It took effect on April 21st.
Another bill that WCASA opposed was AB 489. Also note that there was not a Senate companion to this bill. So this was something that was introduced by the Assembly, which kind of under the guise of human trafficking included this provision that would repeal the healthcare provider mandatory reporting exception. Right, without getting too far down into the weeds of mandatory reporting law, I'm sure you all know that while healthcare providers are mandatory reporters under the law, there are exceptions carved out in the law to allow children to receive certain confidential healthcare services. And those services are generally defined as family planning or obstetrical care, prevention and treatment for STIs. So that would carve out that exception that healthcare providers are not always required to report. Now, as with many laws, right, there are exceptions to the exception, but we were concerned that by eliminating this exception would impact the ability of children, particularly adolescents, to receive healthcare services and to receive confidential healthcare services. And so WCASA opposed that, and the bill did not pass. And I think also noting there that there was no Senate companion. I think this is something we need to keep an eye out, though, for in future sessions.
All right, we're nearing the end of the webinar. So, how can you help make change? How can you be part of the process? There are so many things you can do to support survivors and prevention and services. And I know everyone is incredibly busy, and so that's why luckily, there are many, many ways, big and small and in between, in which you can contribute your assistance. You can join our email list. Probably everybody on this call is on our email list, but maybe not. To join our email list, to receive our press releases, our newsletters, our public policy updates and action alerts, and even event notices, webinar notices, email Peter, which is Peter F, P-E-T-E-R-F, at WCASA.org. He is our event and technology coordinator. You can also find us online at our website, WCASA.org, or via Facebook and Twitter and YouTube. I'll also provide, you will see in a slide or two, actual links to those social media channels. Again, save the month, the entire month of March for Legislative Advocacy Day. Very important. And feel free to contact us to see how you can help, or if you have questions, we're here to be a resource. I also would be remiss if I didn't remind folks about how to find who represents you in the state legislature. You can go to this link. You can use your address in the upper right-hand corner where there's a little search box, or you can just click on your county via the map, etc. You should have one state senator and one state representative / assembly person. You can also go to the Wisconsin Legislature's homepage to find this information and a great deal more about how public policy works, who to contact, about bills, about acts, that is to say, current statute laws, and more. And specifically, we'd like to direct you to the link for our state public policy page. This page is a great resource that highlights some of the most recent or otherwise most important documents, videos, audio, etc. regarding our public policy work here in Wisconsin. And then, of course, there's the legislature's homepage. And then for an archived list of webinars WCASA did regarding the legislative process, you can use that third link. Several years ago, WCASA did a great series that really goes deep into answering questions about, like, what is a bill? How does that get passed? And other important nuts and bolts. Here is our contact information. And again, the links, which you can't miss because they're bold, for our website, Facebook, Twitter, and YouTube. That essentially concludes our presentation. We are open for questions, comments. Ian has found some information.
Yeah, so the question on the pay progression, as I'm reading the budget document, which is, again, I went to law school to avoid math, so it's taking me into that world. The way the law works is that it was a salary adjustment appropriation so that each agency, meaning each DA's office, had a supplement to their salary and fringe benefit, not fringe binge, salary and fringe benefit funding in order to support the pay progression. Now, remember, that is merit. That's a merit-based pay progression. It's not an automatic. So as I'm reading that, I'm kind of reading between the lines that amount was an appropriation for each DA's office, allowing them to use a merit-based pay progression plan. So I guess that's a long way of saying each agency who is funded under the the budget, each DA's office had this ability to supplement their salary and fringe benefit to support the pay progression. I'm thinking that's answering the question, that it's across the board, which was the question, right?
Yes, and in fact, nice work and math. You're very welcome. Thank you.
Thank you. Other questions?
All right, well, thank you very much for attending the webinar. And again, all of this information you'll be able to find on actually the state's public policy page. We will put the handouts of these slides, the summary document of the legislation discussed here is already there. The public policy agenda, I believe, is already there as well. And we'll speak with you again soon.